Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk about blepharoplasty surgery, or eyelid tuck as it's commonly called. You can go to my website, LoveThatFace.com, and select eyelid procedures, and everything we're going to talk about, plus videos and a lot more, are on the website. So what I want to do is talk casually about the experience of eyelid surgery, and I have other videos which I call the truth about facelift surgery, the truth about cheek implant surgery, and we're going to talk about the truth about eyelid surgery. So basically this is a big part of my practice. I've done over 5,000 eyelid procedures, and it's fun surgery. The eye is very interesting, and it can certainly make us look better and younger. So it's not uncommon for patients to come in to my office for consultation. They say, hey, Dr. Joe, you know, I go to the gym, I diet, I take care of myself. When I look in the mirror, that person looks back at me, they look older than I am. And my friends are asking me if I'm tired, and I don't feel that I look as good as I could. And one of the reasons is that our upper face ages faster than our lower face. So we start to see these aging changes in the eyelids, and they make us look older. So it's not uncommon that we're doing eyelid surgery as early as the fourth decade on up. So let's talk a little bit about the situation, because there's a lot of misconceptions and there are some important things. If you go talk to a surgeon about your eyelids and he or she doesn't mention the word brow in the first paragraph, then you may want to seek another opinion, because all eyelid surgery diagnosis starts with the brow. And not everybody is a candidate for a brow lift. Not everybody wants to have a brow lift, but it has to be part of the discussion and part of the options. For instance, I would be a good brow lift candidate. You can see if I elevate my brows, I think that's a positive look on me. Personally, I do a lot of brow lift surgery, but I don't do that much of it on males, because I think it feminizes them a bit. But males or females especially frequently can correct their eyelid problems by performing a brow lift. That elevates the brow into a more youthful position, corrects the extra skin, and reduces the look of the protruding fat. So even if you don't want a brow lift, you have to understand if you're a candidate or not. And one of the problems that we see frequently are people that have had their eyelids done once or twice, and they were never given the option of a brow lift. Well, now they come to me and they want a brow lift, and if I want to raise their brow, they can't close their eye because they've had too much skin removed. So your first question is, am I a candidate for a brow lift? And if you want to check that out, lay down on the floor, grab a mirror, laying on the floor, hold your chin up, and your brows will kind of automatically be elevated, and that kind of gives you an idea. So when people come in for eyelid consultation, they have a number of things going on. In the upper lids, they have what's called hooding, and this is just excess skin and muscle that accumulates over time. And it makes our eyes look thick and heavy, and we lose that youthful crease. Young people have a crease or a shelf above their eyelashes. So the extra skin and muscle produces hooding. Sometimes we also have protruding fat in the upper eyelids. So the fat, the muscle, the skin, all these things get heavy and protrusive, and they make us look thicker, older, and more tired. In the lower lids, we have several things going on. There is a membrane called the orbital septum, and this is what holds the fat that is around the eyeball. We all have fat around our eyeball that cushions and protects the eyeball. Well, this orbital septum, when we're young, is tight. As we age, it gets loose and allows the fat on the lower lids to protrude forward, and these are little fat pads that we get. Now, these fat pads are protrusions of the fat, and it also casts a shadow, especially in overhead lighting. So some people think they have dark circles, which they may. That can be from pigment, it can be from veins showing, but it can also be from shadow. So on the upper lids, what we're doing is we're removing the extra skin, muscle, and recontouring the fat. On the lower lids, we are removing some fat and then addressing the skin. So I want to talk about this now specifically. First of all, usually we're doing If we're doing upper eyelids, we're doing lower, or vice versa, although some people are only doing uppers or only doing lowers. But the average person would do 4 lids. I do this with IV sedation. I think I can do a better job, and I think it's easier for the patient as well. Now, there's a lot of ways to cut skin and muscle and fat. You can use scalpel, you can use scissors. And the eye complex has a very rich blood supply, and there's a lot of bleeding. That's why we get, black eye so easy, or your eye can swell shut if you have trauma. So people that use scalpels or scissors frequently encounter a lot of bleeding, and if you watch blepharoplasty surgery, you see that somebody's always sucking or blotting the blood, and sometimes the blood will run down the side of the face. I use almost exclusively lasers, or we sometimes use radio wave surgery. And laser surgery is bloodless. And when we make these incisions in the skin or the muscle and the fat, there's absolutely no blood. I can do 4 eyelids and lose a Q-tip's worth of blood, a drop or 2. So that's very important, because when you have bleeding, you'll have increased bruising, longer recovery, increased discomfort. When you don't have bleeding, you have less bruising, less discomfort, and faster healing. It also cuts the surgery time in half. So I think it's easier, safer, and more precise. So again, we do laser or radio wave blepharoplasty. On the upper lid, we make an incision that's hidden in the eyelid crease, and we remove the excess skin. We take out a small strip of the muscle, and we reduce the 2 fat pads that are present if it's needed. In the lower, it is not uncommon for some surgeons to make an incision under the eyelash and to remove fat from the outside and then cut some skin off. That's how that surgery was done years ago. And most contemporary surgeons are approaching the lower eyelid in a different manner. They're doing this through the conjunctiva. So that means that we're pulling the lid down, we're making an incision inside the eyelid so there's no visible scar. By doing this, we preserve the orbital septum, and the problem with making incisions under the eyelashes and cutting away skin is that it can cause scarring in the orbital septum and pull the eyelids down. This is called lower eyelid malposition, or scleral show, or ectropion, and that's a complication of lower eyelid surgery. So this does not happen when you do the transconjunctival approach, which I think is more contemporary, and 99% of my lower lid blepharoplasty is done with the transconjunctival approach with the CO2 laser. Now again, some surgeons will cut skin off the lower lid. So let's talk about this. What does this do when you cut skin away? Well, it stretches the skin, so it helps with the wrinkles. The problem is it's a temporary help, because as we age, that skin loses its stretch and your wrinkles are back. Plus, it does not address some really important things like sun damage and pigmentation, brown spots, or dark circles, because you're just cutting skin away. You're not changing the skin. On about 99% of our lower lid procedures, we're performing simultaneous CO2 laser resurfacing on that skin. What this does is it actually makes a controlled burn on the skin. It burns off the aged and sun-damaged skin, and new, what I call baby butt skin, grows back in its place. So this new skin is free from any sunspots, sun damage, or wrinkles. So you're making new skin and you're starting all over again. And to me, that lasts a lot longer and looks a lot more natural. The recovery is a little bit worse. It takes about 10 days or so for this skin to heal enough where women may consider wearing makeup. But I think it's a superior means of managing the skin, using technology, and not using old-fashioned methods of cutting skin away that may in fact pull down the lower lids. So let's talk a little bit about what happens after eyelid surgery. Again, it takes us about 45 minutes to perform 4 eyelids, 4 eyelid blepharoplasty with a CO2 laser resurfacing. And afterwards, we recover the patient, and we immediately put a cold compress on the patient. And by the way, on my website, lovethatface.com, or on YouTube, I have specific dedicated videos for eyelid recovery. But it's really simple. If we've done laser, we want to keep an ointment that we give the patient on the lasered area. Otherwise, we want to keep cold packs on the eyes for the first 48 hours. Very important not to do anything that's going to increase your blood pressure. Cough, sneeze, strain on the toilet, bend over, lifting, exercise. You really need to be a couch potato after eyelid surgery, because if you bleed inadvertently behind your eye, it can be catastrophic. Eyelid surgery is very safe, but it's really important that you have your recovery set up where you can just take it easy, ice your eyes up for a couple days, and I'd say the average patient takes a week off for eyelid surgery. So I hope you enjoyed this video, and again, look at our website, lovethatface.com. There's much more information about cosmetic blepharoplasty and other procedures. I'm Dr. Joe Niamtu.